Hi guys, this is how to get the most out of your sample, the quick and dirty blood film. I'm Saundra Sample. I'm one of the clinical pathologists here at the University of Missouri, and I will be giving you your tour through this talk today. Just before we get started, I wanted to introduce myself a little bit. I graduated from Denison University in 1999 with a degree in biochemistry. I went on to do veterinary school at the University of Illinois in lovely Chambana. After that, I had a bit of a gap year where I was sorting out what I wanted to do in this field and ended up deciding that I needed an internship. And I took a position down at VCA Animal Referral and Emergency Center in Mesa, Arizona. Did my internship there, went in a good doctor, came out a very tired and much better doctor. I took a position from there in suburban Chicago at Arboretum View Animal Hospital in Downers Grove, Illinois, and practiced emergency medicine there for 5 years. And this was a hugely impactful time for me in terms of developing who I am as a clinical pathologist. Towards the end of that time, I made my way back into academia and took a residency in clinical pathology at the University of Wisconsin in Madison. It's amazing 3 years. In 2014, I had finished up with that and headed down to the beautiful island of St. Kitts, where I taught many wonderful Rossies for 5 years and made it up here to Columbia last January. So for this position and in Missouri. And outside veterinary medicine, I have an amazing and supportive husband named Jeff and 3 lovely kitty cats. And I play Dungeons and Dragons. So that's my big hobby and creative outlet. And I'm happy to nerd out with any of you other D&D players out there. So enough about me. Why are we here today? My goal for this talk is to refresh your memory on the utility of blood films and hopefully inspire you to bring them back into your daily practice in a practical and relevant manner. We know that we have been taught that alongside any CBC, we should be running a blood film and doing a full systematic review of that blood film. And in real life, when we are seeing patients every 15 to 20 minutes and sometimes double booked rooms, and we're running around, we don't have time for a full systematic blood review. So what we do, we either send it off to a laboratory, and hopefully your technician or yourself has made a blood smear to go alongside that, or we don't run one at all. It's the reality of practice. We just lean on those analyzer results. What I'd like to do today is to review a few key features of the blood film that you can quick and dirty put your eyeballs on in a matter of 1 to 2 minutes and get relevant information that you need about that patient to allow for point-in-time intervention, either diagnostically or with therapies. Because in real life, sometimes we need to get some information off that blood film. So this is how we're going to go about doing this. First, we're going to set ourselves up for success. And then we're going to review platelets, what they look like, where we find them, how we estimate their numbers. We're going to check out our red blood cells, identify what makes a regenerative anemia, and review a few key red cell shape changes that may impact our clinical approach to things. We're going to wrap all of this stuff up by looking at leukocytoses, really high white cell counts, and getting some key information out of those so we can move forward in a timely manner. All right, first up, setting ourselves up for success. Okay, so here's the deal. Before we can look at a good blood film, we need a good blood film to look at. So seems totally reasonable, right? Yet I would guess the majority of us don't make good blood films, if we make blood films at all. I certainly didn't in clinical practice. I had a vet tech who made them for me. It was great, except when she wasn't around. And then I was on ye old struggle bus. So here's the deal. If you aren't proficient, it is worth taking a little time to become proficient at this. The very first day of my clinical pathology residency, I walked into the laboratory. I was given 2 slide boxes and a tube of blood and said, "You're a clinical pathologist now. You need to know how to do these." So I sat down, taught myself how to do a blood smear, and it took about 100 slides. So figure 100 slides to proficiency. That's 2 boxes full of slides. It's going to take a little bit of time. So here's the deal. Someday soon, we won't be overwhelmed with quarantine pets and owners with too much time. You have one of those nice slow days, maybe a snow day or bad weather day, throw yourself a blood film party, okay? You're gonna need a couple of things. One, a friend who knows how to do good blood films. And if you don't have a friend who knows how to do good blood films and can teach you, there are YouTube videos out there, lots of them, on how to make a good blood film, okay? So first 2 things, get yourself some instruction. You will need 2, count them, 2 slide boxes full of slides. They aren't that expensive. It's going to be okay. It's worth the investment. And 1 tube of blood, purple top tube, nice little EDTA. Make sure it's nice and mixed. Okay, it's going to make your life a little bit easier. 1 of those. And something to apply that blood to the slide. I use microhematocrit tubes. Piece of cake, right? You're going to sit there and you're going to start doing these. And you're going to make them until you get a pretty little blood smear, and then you're going to continue to make them until you know that it's not just luck, okay? And you've got that movement down and you've started to remember how to do this. It's all about building that muscle memory. Once you've had your little blood film party, make sure you practice it. Give it once a day for a couple weeks, where for 1 patient, you make a quick blood film for them. It'll help lock and sink that skill into your hands so you can get back to it whenever you need. So what does a good blood film look like? Pretty little blood film, all right? So we've got several major regions here. First being our application point. So we put our drop of blood on that application point, and then we spread it out across the slide. And as we spread it out, it goes from being really, really thick and dense to very thin and feathery. There's feathered edge down here at the very end is a really important region, and it's going to be a region that we're going to be putting our eyeballs on. Okay, so the feathered edge is a big region, and then the monolayer. Okay, you can even see when we look in at these films, if you just look at them, you can see where that monolayer is. And the monolayer is where the red cells are in a nice, comfortable space. Okay, they've got enough room to spread out, okay, and be comfortable and not overlapping and not stuck to each other, okay? They just a nice, comfortable space. I use the analogy with my students in a classroom. If you've got a classroom that's full of students, they're all in their seat, they've got enough room to spread their books out, they're not sitting in each other's laps. You want them to have nice, comfortable space, and that's where we're going to be looking at a lot of different features. So without further ado, I think we are all set up for success. Let's look at some platelets. Okay, platelets. When do we care about platelets? We care about platelets when they aren't there. Our severely thrombocytopenic patients, right? And before we can identify that something is not there, we need to make sure we know what it looks like when it is there. So step 1 with our platelet review is we're going to refresh our memories as to what platelets look like. Platelets are small cytoplasmic fragments. If we remember, they come off these huge megakaryocytes in the bone marrow that extend these proplatelet processes through the endothelium and shear off little bits of that cytoplasm. And in that cytoplasmic fragment are a ton of granules. So what we are looking for little round things typically, usually smaller than an erythrocyte, but not always, with little purple granules in them, like kind of that pale blue cytoplasm, purple granules, no nucleus. That's what we're looking for in these patients. Okay, so let's go ahead and take a tour. All right, looking at our different species and what platelets look like, and there's subtle variation between them. For the most part, they look pretty similar, but we'll just take a quick peek here. With a little more emphasis on dogs and cats, because I think that's mostly when you're going to be checking for platelets in our animals, sometimes horses. So in our canine patients, very much as we described, they're cytoplasmic fragments, no nucleus. So you see this sort of blue cytoplasm here, and chock full of purple dot granules. Some of them have more granules than others, depending upon like what broke off of that megakaryocyte. But pretty uniform size as we tour through here. Our feline patients, similar appearance. They can have a little more size variation than our canine patients. One of the things that happens with felines that's feline specific is their platelets tend to be a little more sensitive, and they will activate on the negative charge of the glass that we spread our blood film across of. So our felines, we can sometimes see their filopodia sticking out of their platelets, and a little more size variation in those guys. Equine platelets, when we're looking at our horses, they tend to be a little more pale than our dogs and cats. Can take, actually in some instances, a little more time for them to come out from the background to be able to pick them up. So this particular picture, they're softer than what we were seeing in the dog and the cat, but they're still able to be picked out. I have in this particular image, a clump of them. We're going to be looking at platelet clumps in just a minute, and this patient had quite a few of them. For our bovids, they tend to have very small platelets, little itty bitty dots. Just like they have small red cells, they have small platelets. They'll have more of them than we normally see in our dogs, cats, and horses. So they make up for that small size by increasing the number of them to ultimately keep the same amount of volume that's in circulation. So now that we know what platelets look like, where do we find them? We're going to be looking for two places within the blood film to evaluate platelets. The first place that we're going to look at is we're going to do a low power scan along that feathered edge at the far end of the blood film. We're going to be doing this at 10x. Okay, so it's a nice little efficient cruise down that edge looking for globs of platelets. And what do you suppose globs of platelets would look like? Clumps of platelets look like that sort of pale blue with purple bit dots in there. You'll pick up at lower power more of the pale blue to them. And as you come across things, if you aren't sure what it is, go up to high power and take a peek. So for example, I have a nice little high power view here of our friend from our horse that we were just looking at, who had platelet clumps along the feathered edge. And you can see they're all kind of stuck together in just sort of one little layer. So why do we care about platelet clumps? This is a question for you guys. Do they mimic leukemia on our CBC analyzer? So when we get platelet clumps back, we don't know if maybe this could be a leukemic patient. Do they falsely increase your platelet count? Or do they falsely decrease your platelet count? Quick review. What do you think? So for those of you who answered, they falsely decrease your platelet count, you are absolutely right. Oh, bravo, well done. So yeah, they falsely decrease your platelet count. So how the analyzers will work is they evaluate platelets based on their size. And when they clump together in these things, they will come across as being larger in size. And depending upon your analyzer, they'll be counted as one of three things. They'll either be counted as larger platelets, if the clumps aren't too big. They'll get caught in the red cell category, or they'll get caught in the lymphocyte category. One of those three options there. There isn't enough platelet clumps in any given patient to impact your red cell or lymphocyte counts. Once in a while, maybe your lymphocyte count might be a little bit up. Red cells definitely not an issue there. And it depends upon your analyzer type as to where they end up categorized. But it's important because we're talking about thrombocytopenic patients, right? So we get this blood count back from our analyzer that says our platelet count is low. The first thing we want to do is make sure it's not because they're clumped. Clumping's super common, happens all the time, especially in cats. They are professional platelet clumpers, and can sometimes give you those falsely decreased numbers. So step one, we're going to look for the feathered edge, and we're going to look to see platelet clumps there. If we see a whole bunch of clumps there, you know that what you have on your analyzer report is a minimum platelet count. I mean, at minimum, they have XYZ number of platelets, all right? The second place we're going to go to look for platelets is we're going to look in the monolayer, and a very specific part of the monolayer. We're going in to the deeper end of it. We want to be in the area where the red cells are just beginning to think about overlapping a little bit. We may see one or two overlapped red blood cells within our space there. And at that sort of level of the blood smear, we are going to take a look around and do a platelet estimate. So there's a couple of different ways that we can do a platelet estimate. The formal way of doing it is that you take this area where they're just starting to overlap, you count all the number of platelets in 10 different fields, you take the average, you multiply it by 15, and that gives you a platelet estimate. There's a quick and dirty way to go about doing this, and that is knowing what your minimum platelet count should be, which is around 100,000 for our small animals, and our equids can go down even a little bit lower than that. So when we look at these fields, rather than counting and recording 10 fields and taking an average and multiplying it by 15, you want to make sure there's at least 7 to 10 for our small animal patients in that field. For our equids, 4 to 7. In that same range, we're going to cruise around there and make sure. Okay, let's practice an example. I have an image here that we're going to pretend is what we're seeing through our microscope as a high power field. Can't capture the entire high power field on a microscope camera, so we're just going to use our imagination here. What we have in this particular field, and we can see that it's an anemic patient. We're a little bit farther into the depth of field. You can see here where there's a little bit of red cell overlap, just a little bit. They're just starting to touch, and this is where we want to be looking. So we're going to practice going through this field. When I'm looking here, I see 8 platelets. So 1, 2, 3, and 4, they're right next to each other. That fourth one's kind of overlapped on the red blood cells. 5, 6, 7, and 8. Okay, total of 8. So how are we going to do this? Well, one of 2 ways. We can take that 8, multiply it by 15, get our 120,000, or we can just say, hey, it's a small animal. I want it to be at least between about 7 to 10 per high power field. Great. We're at 8, right in that range. Piece of cake, moving on with life. So that is sort of the quick and dirty on how to do a platelet estimate. Let's practice a case. So we have an adult dog, running through our platelet analyzer, and we've got back a total of 3 times 10 to the third per microliter, so 3,000 platelets per microliter. And our reference interval is 140 to 350,000. So severe thrombocytopenia, if this is real. Where are we going to go to check? Well, first on the blood smear, we're going to come down and scan that feathered edge. So just cruise right on down that puppy. And suffice it to say, there are no platelet clumps here. Next, we're going to come back deeper into the blood film. And so farther that back end of the monolayer. And we're going to come in here and take a look, and we're going to count a whole bunch of fields to make sure there aren't any platelets there. For this example, we're just going to go through 5. So we've got this one, no platelets. This one, I don't see any platelets here either. How about this one? Nope. 4th field? No. 5th field? Still no platelets. So not a platelet to be seen. The tumbleweeds are rolling by. We aren't seeing any platelets here. So is this really a platelet count of 3,000? Yeah, this is what it will look like on a blood film. Severe thrombocytopenia. You know what platelets look like. Don't be fooled by other stuff. Trust your guts. So there you go. Before we move on, quick platelet recap. Done lots of platelet stuff. They are small, anucleate, cytoplasmic fragments full of little granules. We are interested in them mainly when there's a thrombocytopenia. Our first question is it real? Are there platelet clumps along that feathered edge? And then if they are not there, then we can go back farther into the smear and look at the deep end of the monolayer and see if there are any platelets present there. We know how to estimate platelets. We can do it with the mathematical equation, or we can just do our shortcut of there should be at least 7 to 10 per high power field in our small animals and 4 to 7 per high power field in our equids. All right, that wraps it up. Let's move on. Regenerative anemias, here we come.